Hey, Dr. Lindsey and Wendy here. We're going to do a couple of videos today. The first one is 14 and 21 month follow-up on 2 transgender patients. And so, unfortunately, neither one of these people would let us use their whole face. One of them is thinking about doing an interview, which would be really revealing on how much of a change this has made in their lives. So, patient 1, Rachel, came in with a masculine hairline, male pattern baldness. Now hormones are taken care of, and we did this 2200 graft case on. And you'll notice the hairline plan is really Wendy's hairline. So what I do is I just have people stand beside Wendy, and I tend to draw what I think looks good on Wendy, and then have the patient adjust and make corrections as they see fit. And then we go ahead, and here's the end of the case. Here's the strip scar at 6 months, just a fine pink line. And then this is a picture that was sent in to us at 21 months. And if we could show you the whole face, I mean, it is, go describe it, Wendy.
No, it's full of joy. She's so happy. It's just changed her attitude.
Yeah.
And she's
from doom and gloom to, I mean, just, it's huge change. Yeah.
It is. She said, what was the text that she sent to me? I showed it to you. I think she said, "Thank God for you guys," or "God bless you guys." Like, yeah, I mean, she is over the moon. She's really, really happy.
All right, patient 2, Laura, similar age person, came in with some male pattern baldness, and not a whole lot of hair in the frontal triangles. Need a little smaller case, but finer hairs to work with. So again, I had the patient stand beside Wendy. I drew this hairline. Here's the end of the case. And then this was a couple of days ago at about 14 months. And, you know, I was standing at the front door when the door opened, and I was expecting this patient to be walking in, but last year, the whole demeanor of the person was like, and it was transformative. The energy and personality and the way the person carried themselves. Don't you think, Wendy?
Yes. Yeah.
I came and got you. I said, "You're not gonna believe this," you know.
Yeah, we were waiting. And she's timid too, but she wasn't timid this time. She was just open. And I said, "Oh, it looks good." And she wears like little bangs.
Yep.
And we were talking.
And I don't really like those little bangs, because when you pull it back like you got your hair today.
I was like, "Oh, that's my hairline."
Look, here's a close up of the hairline, and when you stick your big head over there towards the camera.
I'm too short.
Yeah. Well, I think, and you come back up.
You see? Yeah, you should. Yeah. Right there.
So, again, we do a handful of patients like this every year, and I would say 2 things. One is that the transformation in the way the person carries themselves, so far, has always been huge, and it's really rewarding for the 2 of us.
Yeah, that's the most.
Yeah.
For me, those are like I said.
And they tend to follow instructions, keeping their head clean, which I think makes things work better. If we can help you, please give us a call. Thanks.